The health secretary would not be doing his job if he did not ring hospital bosses who miss A&E targets, the Department of Health has said. It comes after David Pryor, chairman of the Care Quality Commission, CQC, told the Daily Telegraph it was crazy for Jeremy Hunt to take that action. Mr. Pryor also branded targets hugely distortive, but Mr. Hunt's spokesman said patients needed guarantees. Labour defended the use of targets, brought in while it was in power. Shadow Health Minister Jamie Reid said the targets had cut waiting lists and increased patient satisfaction. But Dr. Richard Vautry, deputy chairman of the BMA's GP committee, said targets set nationally did not help to improve morale among health service workers, and can sometimes hinder the ability to improve our services. Held accountable. In the interview, Mr. Pryor, the head of health regulator the CQC, criticized Mr. Hunt for directly calling hospital chief executives, saying, "There is an obsession. It's crazy to have a Secretary of State doing that. Of course he's doing it, because he's held accountable, but what it all leads to is more money being put into A&E departments when that money should probably be put into primary and community care to stop people falling ill," he added. The former Tory MP and deputy party chairman also voiced concern over targets. The whole culture of the NHS became so focused on targets that it obscured what real quality was about. The voice of the patient wasn't in those targets, he said. Mr. Pryor said that when patients arrived in A&E the clock starts ticking and not a lot happens. At 3 hours people start to get interested, and at 3 hours 55 minutes the chief executive is down in the A&E department. That doesn't make any sense, he said. Mr. Pryor also said he felt the NHS became too powerful to criticize despite many patients receiving a wholly unsatisfactory service. Missed targets. A spokesman for Mr. Hunt said some targets, including those for A&E waiting times, had been relaxed and others scrapped since the coalition came to power. However, he said there was a balance to be struck because the public needed guarantees that they would be treated quickly. The spokesman also defended the performance of A&E units, saying they were holding up well and more people than ever before were being seen within 4 hours. Mr. Reid said, in 1997 people were waiting for months and years to be seen and receive treatment, but by 2010 targets had helped to deliver the lowest ever waiting lists and patient satisfaction was at a record high. That is why this government has continued to use targets. The focus now needs to be on the winter crisis engulfing A&E. When Labour left office 98% of patients were seen within 4 hours, but the government continues to miss its own lowered A&E target.